Go ahead and state what your chief complaint then is, like what brings you in today.
So it would be, I have a lot of neck pain. It's all like upper neck, sometimes in my shoulders just a little bit. It really doesn't like travel anywhere to like mid back or lower back. But like starting at the top of my neck to like the base of my neck is usually really tense.
That's just your main culprit?
Yeah.
The right-hand side of your neck has a lot of strain.
That's definitely where I feel most of the pain is in the right. Like after exercising, I usually get tons of pain.
Yeah, the right-hand side is just in a clonus almost. Ooh. And here I am trying to persuade it to come back, and it's capable of it. It's capable.
It's got potential.
It's got potential. Well, sometimes I fiddle with things and it goes, no.
Yeah.
But
Psych.
No, this is actually working. You are leaning into this right-hand side.
Okay.
That's why I was asking if maybe you like really served on this side, but you're saying no, it's pretty equal both sides.
Yeah.
Okay. Now what I would like to take you by the end of this is here and then chin back up for me.
Whoa, that feels weird.
I would like to take you all the way back to here and you not have that reaction.
That's normal?
As normal.
Yikes.
Yes. That is going to be normal to you. And oh my god. I'm just going to lift up here.
Okay.
You don't mind me I'm just going to show the lower part.
No.
Yeah, she's like really tight in here. Same thing, cross your arms. I'm going to, and let's do that. When I take you back, yeah, whoa, okay, I just popped some stuff.
I didn't know those things could pop.
Yeah, look at that. Okay. So what she's got here is you can just tell that this part here is going to turn like bright red with petechiae. Just me fiddling with it, like going up and down her neck, so like I can feel it. Okay, she's got a little spot right here. Big spot right here. Even though she's got a lot of tension in the deep structures of her right-hand side of her neck, the superficial stuff, which is on the surface, the first centimeter, right here, right up here. So here, here, here. Okay.
And what is that?
It's like congestion, okay? And that's all on the surface. The deeper structures are more like the beams and rods that hold you up.
Okay.
The muscular tissue and how the soft tissue responds to that imbalance sometimes doesn't match the structure itself.
Okay.
It matches it, but not directly. There's compensation. See, look at that. You kind of find the body curling and winding itself.
Right.
And yeah, we get little spots. Now, have you been worked on before?
Not besides the
massage. Have you been adjusted?
Like
just
3 times,
very
but
briefly.
very briefly.
Okay. I'm wondering how far to take you here. She's got a curve over here on the left. That's why it was easier for her to turn this way, because as the body curves up to go that way. And then if I ask this curved structure to go this way, it says no. Okay.
Yeah, that's pretty noticeable, actually.
It's okay. And here's the compensation. So right, left, right again. Okay. Do you mind if I take the ponytail out?
No, not at all.
Okay. There you go. When was the last time you were adjusted, though?
Probably a year ago.
Okay. Because this feels awfully stuck, like it's been a while, I should say.
Well, the only thing they did when I got adjusted, they just cracked my neck either way, cracked my mid-back, which wasn't having problems before, so I'm not sure why, and then I left. That was all they did.
Well, it's okay to get things moving even if you don't have a complaint. You know, do you brush your teeth only when you have tooth pain?
That's fair.
Okay, so they're trying to align the spine as best as they can so that the sludge doesn't build up in the spine.
Okay.
I just like to clean up the gutters a little further.
Right.
Okay.
The trenches of my body.
Yeah. I like to take you a little further.
Ouch.
Take you a little further. How far can we go?
We will see.
You know, drink a lot of water.
Yeah.
The more water you drink after this, the faster you'll flush yourself out.
Okay.
If you don't drink enough water, you will be sore. You'll know. I didn't drink enough. Oh. Okay, breathe. Just a little nugget over here. Ooh. Ooh. There we go. Stretch. Okay, then what's this over here?
Ooh, that's popping, doing some weird things.
Well, this might be the beginning of that scapula that you were talking about.
I feel that.
Yeah, it's just all kind of crunched on this side. We call it the four corners. I've got these corners up here, okay?
Yeah.
So I take you up like this, get it, and then rock that under like that, shake it. That's let go. It should just slide into place. Chin back for me. Just real nice and easy. Ooh. Yep, there you go. Piece of cake. Here we go. Chin back. It's right here under my finger. I think I've got it all. Yep, closed. Very nice.
Ooh.
That's a lot of energy to go into the neck, okay? So I just kind of like let that bubble disperse, and then I come back and grab onto you, and we'll go for round 2 here. There you go. There's a little bit of a catch at the bottom of the left. Right down in here. I'm going to get it in a second, okay? I just want just hang out right there. I'm going to do the toes, okay?
All right.
Everything moves. The big toes have a little bit of trouble. Not too bad. Nice. Whew, cuboid. Okay. Talus. Come over here, cuneiforms and cuboid. Come on and sit up and test that neck out for me. Just take it right and left. Yep. How's the shoulder feeling? Is anything still catching? Okay, go ahead and look right and left for me again. Okay, seeing the catch down here on the left-hand side. Hands on your hips for me. Let's test the shoulders out. Your elbow's gonna come back and towards mine. So you're just gonna press your elbow back in. Good. And here. Ooh, now we're gonna go this way. Yeah. Interesting. We've got one anomaly here. Any tenderness in here?
Not a lot. No. Not really.
Okay, I'm gonna figure that out. All right, regardless, I'll figure it out in a second. Now let's see if I can feel that adhesion down here. I'm just gonna pull, okay? Whoa. Yeah, there's a big one. No, that's all it's gonna go. Okay, so take a deep breath in for me. And all the way out. Okay, that hurt. Yeah. Yeah, that one's really out. All right, deep breath in. Any, did it hurt? No?
Mm-mm.
Okay, I'm just gonna push, 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 push. Good. And out. Okay. Deep breath in and out. Yeah. Okay. There's one over here. Do you mind? I'm just gonna try it. Just. No. All right. All right. I gotta like tease this out. This whole. Ouchies, I know, little lumps and bumps, all normal. All normal.
Snap, crackle, pop.
Yep. Oh. Well, because kind of look at how this one, like, can you relax that one as much as it goes? There we go, maybe that. There. Now I can see. It looks pretty even. You look good. So I'm not feeling, look, they feel about the same. I'm gonna give you a double whammy here. We're not gonna, usually I take it one at a time, but on you I'm just like, nope, let's just do them both. They feel symmetric. Symmetrical. If anything, this one wings a little bit more, but nothing. But that's just because the curve is over here on the left. So it, as the spine pulls away from the scapula, this will come up and it'll appear more prominent. But it's not bad. It's nothing. It's terrible. Oh, got a little bit more pops. Okay, that's about as hard as I'll take you. How did that feel?
That felt fine.
Okay.
Definitely painful, but nothing I couldn't handle.
I mean, that's pretty deep there. There you go. And now I'm gonna bounce. Yeah, so what happens is, okay, in my opinion, this is what happens to me when I get adjusted. If I have a chiropractor come in and they just pop one rib on me, like really hard, and then they don't get everything else to move along with it, and then they don't take the soft tissue and then like drive it on down with the bone, I will be sore. And it will be like a sharp pain. So I kind of come in here and I find the little catches, and yeah, I know it's painful, but I know that when I stop, it'll feel so much better.
Yeah. I'd rather take some temporary pain to alleviate some more permanent pain.
I know, this, I'm gonna come in here with my elbow a little bit. Do I need more? All right, you're gonna come up and over, kind of like lean your head off this way. Yes, I gotta open this side up. You okay?
Yeah.
Yeah, I'm gonna come in here and This side's your crumpled side, remember? It's the collapsed side.
Mm-hmm.
So I'm trying to, like, stretch that open. Are you okay?
Yeah.
Okay, here we go. Just open that up. It's not the most pleasant thing.
Doesn't feel too bad, actually. I don't mind this.
My girls are so tough today. I'm, like, leaning into you, too. Right there. I mean, my God. There was a knot I just went right through and you didn't say anything. I'm like, really? Yeah, there goes another one.
Ooh, I felt that one.
Yeah, there it is. All right. Oh. All right. Okay, come back to neutral. Okay. I just don't want to hold you there too long before it cramps. Yes. There we go. Now we're getting somewhere. Okay.
That tickles.
SI joint. Well, the next step is just pain. So it's like, how far do I take her, Do I take her all the way? Not to 50? Okay, relax. Work on that glute a little more. That was my knuckle. That doesn't count.
I was gonna say, I heard something, but I didn't feel it.
That was my knuckle. Thank you. Above my finger. I might need a different one on you. This one doesn't feel like the right. It feels a little too thin. Oh. You're not bruising too bad.
Okay.
Just like one little spot here. So actually I'm going to have you go the opposite way for this one. Come up and over. It's the same thing we did, but like that way. Yes. Let me pull it out of here. Seems to be the only spot. Oh. Sorry, I don't want to go on your spine. Ribs feel great.
Yay!
All right, so let's go to the problem area that you're talking about. You can go face down again. You okay?
Mm-hmm.
Tiny bit. Everything's matching what you're saying. So I'm gonna maybe listen to you a little more. Most of my patients, I just kind of nod my head. head and say, okay, we'll see. It's not that I'm not listening, I just kind of do my own analysis. But
Yeah,
on you, it's like,
I'll figure it out anyways.
But on you, it's like, wow, it's actually matching what she's stating. That doesn't happen too often. They have pain on one side, and then there's a problem over on the other side, pulling it out of alignment. You know what I mean? But on you, it's actually where you're stating it, that you have a problem. All right, is this okay? I know it's kind of rough on this region.
Yeah, it's okay.
I'm gonna use my other one. Now I predicted there would be one up in here. I felt it. Yeah, just in here. Ooh, you feel that?
Yeah.
Ugh.
Oh yeah.
But it really isn't bad. This is the only spot you're bruising.
Okay.
I'm gonna check the left-hand side, but yeah, let's go into the left. That's all that side's got. A little bit here, you know, it is what it is. But it's not bad. Here, we'll take a picture of it for you. Okay.
Oh wow.
This all in
You
here.
can see it though.
But your lower back,
Yeah, even like looking at it.
there's nothing.
Mhm.
But nothing shocking.
Yeah.
Nothing like terrible. So I'm gonna go into the chest. I'm gonna move. Oh, there's a little one here. Okay. All right, I am gonna go, I don't know how much more. Is this just feeling irritated? Should I just stop?
It's not that bad.
Okay.
It's manageable.
I mean, there's always more stuff I can do. But I can't quite, like, if I grab onto you. No. Chin, head back. Wow. Try pulling the shoulders back now. I am curious. How does it feel to do that? Does it feel as abnormal as when we started?
Kinda.
Still feels abnormal?
I mean, it doesn't feel like it doesn't hurt.
Like if I'm, like this is how I kind of want you to be. Does that still feel really weird?
That I feel like a little bit of tension right here pulling my shoulders back.
Okay. Well, we haven't done the pelvis yet, but still. Okay. She's got a problem here and it's still pinching. This is a direct correlation to the pelvis, okay? Because the muscles hook onto each other here. Mm-hmm. All right, so when I look at her pelvis, let's see. So I'm looking a PI ilium, yes, on the left. Okay, do you see that?
I can't.
It's almost aligned with all of the work that we did. So I'm looking at this little bumpity bump compared to this little bumpity bump. They're called the medial malleolus. They don't change. I don't look at the heels, I don't look at the toes. I look at the bones, the actual leg bones right here. And this one is just about a centimeter shorter than this one, okay? And I go like this, and I come down like that about 90 degrees, and I still look at the feet heights, okay? And you can still see that this one, it goes long. Now watch this. Let's come in here, and I'm gonna press on your glute, okay? Mm-hmm. Come, pull her down like that. That almost fixed it, okay? And I'm gonna grab here, push up. That really fixes it. So that tells me which way I have to align her sacrum and her pelvis. Now, I can also take this side of her pelvis and push in this rib, because this is also a direct correlation. So the leg lengths just tell me whether I've done my job. Okay, so yeah, we're gonna head back off the table. Feeling okay? Yeah. Oh, relax though. I know, I got you. Ooh. All right, other side. This side's the side. Yeah, careful. I know, I'm gonna be very careful. Grab it very carefully here. Okay, it's a little jammed right here. Are you okay?
Yeah.
Is this rib hurting you at all?
No.
Okay. There we go. All right, perfect. On your back. Just get it. Bend both of your knees, feet on the table. We're going to do the pubic symphysis right here, okay? 9 out of 10, it doesn't go. If it doesn't go, it means you don't need it. If it goes, it means you need it. Okay?
Fair.
5, 4, 3, 2, and 1. And then you're going to squeeze. Squeeze. 5, 4. Oh.
I felt a little something pop.
Yeah.
That was weird.
Let's come on and stand up and let's see if we can't pull you back.
Okay.
Without too much, just, well, you're 100 times straighter. Oh my God. We have the footage. Come on and look at her from the side.
Well, there you go.
We got the footage from before, right? Yeah. This whole section has come back. It's amazing.
Yeah, I think before I was like,
Yeah, you don't even want to do what you used to do you? Yeah, that's amazing. Yeah, you're back. And then this is all we got to get back. We just got to get the top, which is the hardest part. But this is the first part. Do you still feel it pulling here? No? Okay. This here is okay, this here is directly linked. There's little cables that hook from here to here.
okay.
So when I take you back and you're like, ow, well then we gotta unwind the pelvis.
Gotcha.
Okay. All the way back. Now this is gonna be a stretch for you.
Okay.
Because most of my people are twice your size. Bend your knees. Now, can you roll up higher on there?
Like
Yeah,
here?
yeah. Right, the gua sha is like just superficial. You're just trying to get, I work down at the deep, the adjustment's deep, and then you slowly go through the layers to the top. This is gonna be a little painful.
Okay.
I know. You're gonna come off these sideways. It's okay. It's like ripping a Band-Aid off. I try to hold the ribs as you come off. There you go, just relax. Okay, you did it. All right, come on up and see how it feels. Ooh, yeah.
Yeah, I feel it.
You're like, oh, I know.
Ooh.
Yeah, there you go. Yeah, you're gonna feel sore for a few days after all that.
Okay.
Because I just mashed your spine. Okay.
Made mashed potatoes out of me.
Yeah. Now, does it still feel a little irritated in here? In the neck? A little bit? Okay. Well, that might take the longest to feel better from is that neck. Yeah, I worked on her pretty hard in her neck. So that might take the longest.
But necessary.
Well,
How often should she have it done?
she needs to do the exercise like every day.
That thing?
Yeah, like or take a foam roller. Maybe let's stabilize and you can hold on to yourself.
That feels a little bit more natural, I guess. But yeah, it does feel.
Yeah, what happens is if you don't keep doing that, you won't be able to do it.
Okay.
You know, the more you take your chest out, the easier it is to go back. But with your shoulders forward, it puts a lot of strain on the neck.
Right.
So get your shoulders back. Yeah, and go back. Yes. Okay, so when you're feeling this ache in your neck and you're feeling this ache in here, it's because these ropes back here are being tugged on so much. So contract them, close them together, close them off, shorten them so that they don't hurt so much.
Right.
Okay, and it looks extreme because we're not used to seeing people like that. Okay, so it looks like, well, that's not supposed to be like that. But because you never see an old person, you know.
Right.
No, they're always. Okay, because that's where it's headed in the future. So don't be afraid. And yoga, right? There's all those postures to go back. Bow pulling pose. You know, all these poses take you backwards because yoga was designed to help you reverse what you're doing in the day.